Welcome to this lecture on female tract cycle changes. Today, we are going to explore one of the most fascinating and beautifully orchestrated processes in reproductive biology. We will understand exactly how the female body prepares itself every single month to create new life, looking at both the biological changes and the mathematics behind them. To begin our journey, imagine you are hosting a very important guest in your home. You would clean the room, put fresh sheets on the bed, and ensure there is plenty of food. The female reproductive tract does exactly this every single month in anticipation of a fertilized egg. The uterus builds up a thick, nutrient-rich lining, like a plush mattress, while the cervix opens its doors and produces a welcoming fluid to help sperm swim. If the guest, which is the embryo, does not arrive, the body simply clears out the room by shedding the lining and starts the preparation process all over again. Now that we understand the overall goal, let us look at the specific biological phases. During the first half of the cycle, known as the proliferative phase, the body is actively building. This phase is primarily orchestrated by the ovarian steroid hormone called estrogen. As estrogen levels rise, they cause the endometrial lining of the uterus to thicken significantly. At the same time, estrogen causes the cervical mucus to become thin and watery. This specific change in the mucus is crucial because it creates a fluid highway that facilitates sperm transport toward the egg. Following this initial buildup, we enter the next stage. After ovulation occurs, the secretory phase begins. Now, a different hormone called progesterone takes dominance. Progesterone transforms that newly thickened endometrium into a highly vascularized, nutrient-secreting environment. The blood vessels expand and coil, and the glands begin secreting essential nutrients. The uterus is no longer just thick, it is now perfectly primed and biologically active, ready for an embryo to implant and grow successfully. This phase is all about creating the ultimate supportive environment for early life. But what happens if that preparation is not used? If fertilization does not occur, the body recognizes that the highly developed uterine lining is no longer needed. The ovaries stop producing high levels of hormones, resulting in a sudden drop in both estrogen and progesterone. This hormonal withdrawal destabilizes the tissue, triggering the shedding of the endometrial lining. Clinically, we observe this shedding process as menstruation. This clears out the old tissue, resetting the system so the beautiful, continuous cycle of building up can start all over again. Understanding these cyclical changes is not just academic. It is absolutely critical for modern reproductive medicine. Without the precise thickening and secretory transformation of the uterine lining, a fertilized egg would have nowhere to attach, making pregnancy biologically impossible. In the real world, fertility specialists closely monitor these exact tract changes using ultrasound. By measuring the thickness of the endometrium, doctors can determine the perfect time for procedures like in vitro fertilization. Mastering this topic gives us the power to assist struggling couples in achieving a healthy pregnancy. Beyond assisting with fertility, this knowledge is also the foundation of family planning. Many contraceptive methods, such as the birth control pill or hormonal intrauterine devices, work specifically by altering these natural tract changes. Instead of allowing the cervical mucus to become thin and watery, these medications keep it thick and sticky, creating a physical barrier that blocks sperm. Additionally, they suppress the growth of the uterine lining, keeping it thin so that even if an egg were fertilized, it could not implant. This provides highly effective family planning solutions. Since we know the uterine lining must thicken, let us look at how we can mathematically model this growth during the proliferative phase. We use a simple linear growth equation. E sub t represents the total endometrial thickness in millimeters at a specific time. E sub 0 represents the baseline thickness of the endometrium immediately after menstruation has finished. The variable R represents the daily growth rate of the lining, which is driven by the hormone estrogen, measured in millimeters per day. Finally, T represents the number of days that have passed. When estrogen levels increase, the growth rate R increases, causing the lining to thicken much faster. Conversely, low estrogen decreases R, resulting in a dangerously thin lining. Before we move on, let us see this formula in action with a concrete example. A patient has a baseline endometrial thickness of 2.0 millimeters. Her uterine lining grows at a steady rate of 0.5 millimeters per day. We need to calculate her endometrial thickness exactly 12 days after her period ends. We substitute these specific values into our linear growth model. First, we multiply the daily growth rate of 0.5 by the 12 days, showing the lining has grown an additional 6.0 millimeters. We add this to the initial baseline of 2.0. The final thickness is 8.0 millimeters, which is an excellent, healthy environment for an embryo. Let us look at another scenario, this time working backward for a patient undergoing in vitro fertilization. Her baseline thickness is 1.5 millimeters, and she has 10 days to reach a target thickness of 9.0 millimeters. We need to calculate the required daily growth rate to determine her estrogen medication dosage. We plug our known values into the equation, leaving R as our unknown. We subtract the baseline of 1.5 from the target of 9.0, meaning she needs 7.5 millimeters of brand new tissue. Dividing this by 10 days gives a required daily growth rate of 0.75 millimeters per day. The doctor must dose her medications to achieve this exact rate. Now that we have calculated these changes, let us visualize the entire process on a graph. On the horizontal axis, we have the 28 days of the cycle. The blue curve represents estrogen, which peaks just before ovulation at day 14, driving the proliferative phase. You can see the uterine lining at the bottom growing thicker in response. The red curve represents progesterone, which dominates the secretory phase after day 14, making the lining highly vascularized. If no embryo arrives, both hormone levels crash near day 28, leading to menstruation, shown on the far left, where the lining becomes thin again. This diagram beautifully summarizes the synchronized dance of hormones and tissue. To wrap up our lecture, let us review the most important ideas we have covered. First, the female reproductive tract undergoes a continuous, beautifully orchestrated cycle of preparation and renewal every single month. Second, this cycle is driven by the rising and falling tides of two key hormones, estrogen, which builds the lining, and progesterone, which matures it for implantation. Finally, understanding the mathematical rates at which these physical changes occur empowers us to track natural fertility and perform life-changing medical procedures like in vitro fertilization. You now have a solid foundation in the mechanics of reproductive biology.